Hello and welcome to Maternal Mental Health Awareness Week, where we are celebrating Year 10 with our theme, A Decade of Voices. I'm Eve Canavan, one of the co-founders of the week, and today I'm delighted to be joined by one of our friends, Dr. Natalie Cook from Little Steps Psychology Practice. We're going to be talking about the difference between baby blues and postnatal depression. Before I hand over to say hello to Natalie, I just want to give a little safety guideline that you'll see at the start of all of our videos. Dr. Natalie and I will be talking today about baby blues and postnatal depression, but anything that we talk about should not replace any information or advice that's been given to you by your own healthcare provider. And with that, hello.
Hello. Thank you for
It is,
having me.
it is a pleasure. I was saying we were having a pre-chat before this, and I was saying Dr. Natalie is so lovely, and I've the last couple of weeks I've been looking over your Instagram page, and I was looking over it this morning as I prepped for this, and I was just thinking I was really encouraged people to give you a follow because you have such a lovely
Oh,
page of reels and posts about the realities of motherhood and when you give your kid the wrong coloured cup. And
yes. Did that this morning.
that's the one I saw this morning, and it all goes
Yeah.
horribly wrong.
Oh, yeah.
And I just thought you were just perfect to be part of the week. So thank you for giving your time for us so graciously.
Oh, thank you for having me. It's really like the work that you do is so important. So it's a complete honor for me to be able to be a little part of this week.
Oh, I'm really pleased. I'm really pleased. All right, so Dr. Natalie, before we go into talking about baby blues and postnatal depression, let us know about yourself. Who are you and what do you do?
Dr. Natalie Cook. I'm a clinical psychologist and I started Little Step Psychology Practice last year. So it's a online therapy practice at the moment where I support parents from the beginning of their parenting journey all the way through to kind of the early years. But in particular, I have a real passion for perinatal mental health. So that's why I feel like we're a good kind of match for today.
Definitely. And I think one of
Yeah.
the reasons that we wanted to talk to you is that I saw a post of yours not so long ago where you talked about the difference between baby blues and postnatal depression. And
Yeah.
actually, that same week, I read an article in the newspaper where it was talking about postnatal depression, but was referring to it as the baby blues. And I
Right.
thought,
Okay.
we absolutely. So I went to the comment section and people were saying, well, what's the difference? What's the time frame?
Mm,
And I thought Dr. Natalie would be really good to talk to us about this. So I thought we could kick off by saying, in
yeah.
simple terms, what are the baby blues? What's postnatal depression and how do they differ?
I guess the first thing I want to say is they're not like two ends of the same thing. They're actually quite different things. So the baby blues is something that happens to most new mothers, around 80% of new mothers actually, and it arrives in the first week after birth, usually between days 2 to 5. And there's a big hormonal drop after delivery. Okay, so that could look like tearfulness that comes out of nowhere, feeling overwhelmed, having those like big emotional ups and downs all within one day. And sometimes like this real like sense of like irritability. Okay. And then usually within 2 weeks, it passes. Okay. So baby blues is not a disorder. It's your body responding to one of the biggest physiological shifts a person can go through. Okay. Now, postnatal depression is different. Crucially, it's not just more intense baby blues, it's very different. So it can begin at any point in the first year after you've given birth. And sometimes it continues from depression during pregnancy, and that's called antenatal depression. Now, what makes it different isn't just its intensity, but it's also its persistence and the impact it has on your life. Okay, so we're looking at low mood for most days for more than 2 weeks. Okay, so what's important to know is it often develops gradually, which is one of the reasons that so many women don't recognize it in themselves. So I guess the simplest way to put it is kind of baby blues is what your body does in response to having a baby. Whereas postnatal depression is what happens when the weight of the transition, combined with lots of other things, becomes something that needs real support to work through.
Okay, I think that's a really helpful overview because I definitely remember when I had my antenatal lessons before I had my
Mm,
son, they talked about being weepy after giving birth and it could last for a little while. And then
yeah,
when I talk to my girlfriends now who I met at baby group 16 years ago, they
yeah,
go, yeah, there was that period after we had the baby where there was a crash, and I felt quite
yes.
blue. But then they talk about how it lifted quite quickly. And
Hmm,
so
hmm.
I think I've got a couple of questions here actually to move on to. So I think, how long does the blues last?
Yeah.
I think you've made a really good point between the difference of them, because I think what we hear often is if it goes on a bit longer, I think about that it might be postnatal depression. So
Yeah.
my question, let me think through my question. How long does the blues last that you can go,
Uh-huh.
okay? And at what point do you start to think, actually, I might be experiencing something more?
Yeah.
And then could we go into what are kind of some of the symptoms of postnatal depression, knowing that we can't give them all here? So does
Mhm.
that question make sense?
Yeah, absolutely, absolutely. So, and stop me if if I haven't answered any part of that question, just let me know and I'll come back to it. So the baby blues should be gone within 2 weeks. Okay, that's the clinical marker that we're looking for. If it's been more than 2 weeks and things haven't lifted, or if things started later than those first couple of weeks, we're not looking at the baby blues anymore. Okay. So the other thing I'd add is it's not just about duration, it's about a pattern. So baby blues tends to move and shift. Okay. So you might have a terrible morning and a better afternoon. Okay. You might cry at a nappy advert or how tiny your baby's feet is. And then you'll be laughing the next minute at something that your partner said. It's kind of emotional, but it shifts. Okay. There's movement. Postnatal depression doesn't shift in the same way. It kind of sits. It's most days for most of the day for more than 2 weeks, right? There's like a heaviness or a flatness that doesn't really lift with getting more sleep, which we all know is basically impossible when you've got a newborn, or like a kind message from a friend or a tasty pastry or whatever it is that usually pushes you through. It's not doing anything for it. So if I'm sitting with somebody and I'm trying to work out what is this? I'm going to be asking two things. I'm going to be asking how long has this been going on for, and does it move? Okay. If it's been more than 2 weeks and it's not moving, that's the point where I'd want somebody to go and have a conversation with like a trusted professional, or a friend, like talking to somebody who can help you. Not because you definitely have postnatal depression, but because it deserves and warrants a proper conversation about what's going on and what kind of support you deserve. Does that kind of make sense?
No, absolutely. And I
Yeah.
think, you know, I was doing one of these sessions yesterday, and people were saying in those early days, there's so much focus on the baby and how the baby feels, and it's the baby weapon
Mm,
and what's going on.
yeah.
And
Yeah.
we do almost forget about the mother in this. And I can remember
Absolutely.
when I had Joe, I can remember saying to John, when they were like, "Oh, you can go now," and as we walked out with the car seat, I remember saying to John, "What, they just let us leave?"
Yeah. What?
I was like, "They just let me go with this baby, and I don't have a clue what to do with it."
Absolutely.
So sleep deprived. People saying sleep when the baby sleeps. You know, my kid never ever slept, and I can just
Neither did
remember
mine.
thinking, how do people have more than one baby? Yeah, because I just thought, what? I don't think I slept till he was about 8. You know, so you
Mm,
think, and so there's all of these things coming on, and we talk about the baby, but then you think, look at the impact on the mother with that.
absolutely.
And I
Yeah.
think you've said that so well. No, you've said that so beautiful. I think because there is a thing of go and have a conversation, because it might not be, but the space for that conversation is what you need and what you deserve. Because that conversation
Absolutely.
is then when you think, how can I kind of go on, you know,
Mm,
from this point. And actually, we get quite a lot of questions come through. You know, we have our symptoms posters, and I've made them this year. And I think if you
yeah.
Google postnatal depression, you know, thankfully, huge amounts come up. But people go, "Oh, I don't think I've got it, because isn't that just when you feel sad? Isn't that
Yeah.
when you feel
Yeah.
numb?" And so, what are some of the kind of what are the more common symptoms of postnatal depression? But also, what are some of the symptoms that aren't really talked about, but that people can
Yeah.
experience?
Totally. So that is such an important question because I think you're spot on. A lot of, or a really common picture that most people have of postnatal depression is like somebody crying or somebody not being able to get out of bed, right? And that does happen and it is serious. But in my clinical work, it's actually not the most common presentation. That's not the thing that's stopping people from doing what they want to be doing. The women I see are often highly functional on the outside, right? They're doing the feeds, they're tracking the naps, they're answering the WhatsApp groups, they're smiling in all the photos. But inside, it can look like lots of other different things that are going on at the same time. So, one of the things that I am always on the lookout for, is it can look like anxiety. Okay. So, relentless worry, hypervigilance about stuff. Essentially, it's like when your nervous system can't switch off, even when the baby is asleep and everything is fine. The other thing that often doesn't get talked about, as publicly is it can look like rage, it can look like snapping, it can look like feeling irritable.
Sorry,
And
I
that
know
can,
this one.
yeah, and me too. And that can feel quite frightening, okay, when it's not talked about and it comes out of nowhere. So you might feel like a different person to the mother that you thought you were going to be. And women almost never disclose those types of symptoms because it doesn't fit the story or the narrative that we are sold and told about what motherhood looks like. And therefore, there's a lot of stigma and shame attached to it. Okay. And then, like you did mention numbness, and I think that is something to think about, right? Because yes, it can look like crying, and it can look like not being able to get out of bed, but there's something about that disconnect, right? That flatness where you feel the warmth should be. That again, society has told you you automatically feel when you have a baby. That not that feeling of it doesn't feel like I expected it to feel like when I had a baby. And people often interpret that as evidence that they're a bad mother. And actually, it's not that at all. Like, clinically, that's a recognized symptom of depression. So, suppose, like, yes, it can look like the kind of typical symptoms of depression of like feeling sad and weepy and not being able to get out of bed, but it doesn't always look like that. It can also look like anger. It can also look like anxiety. It can also look like numbness. And all of those things are worth taking seriously to support somebody going through a difficult time.
I think it's so good that you've talked about rage actually, because I think rage is
Mm,
something that over the years of me doing this work, so my son's 16 now, so I think I started doing this when he was around 4.
yeah,
Rage was never talked about in
no,
2014. And thankfully, in the past couple of years, it's really come through. And I think what's really good you mentioning it is that it's one of the symptoms that people are really scared to talk about. You know, the fact that they have extreme anger.
yeah,
And I've definitely been connecting with this recently because we've been doing some work in the area of perimenopause. And
oh yeah,
I've definitely been experiencing perimenopausal rage, and it's something that has knocked me for absolute
yeah,
six,
yeah,
and I think, and it does actually remind me of the days of when I was poorly after having my son, and that is
mm,
that, it makes me realize how frightening, it was and is. And so
yeah,
I think maternal rage, we always say this, after having a baby, it is the most memorable time in a woman's life. And we know
100%,
in that
yeah,
first year that maternal suicide rates are so high, and it is really
mm,
important we talk about that.
yeah,
And people really worry about talking about their extreme feelings of rage because they worry that people are going to judge them so much, and we do.
yeah,
People will say to us, we get emails that say, like I threw a glass across the room. I just wanted to throw my saucepan through the window. I just didn't
yeah,
know what else to do. I remember Tova Lee, the comedian Tova Lee, I went to see her once and she talks about how she had like this enormous meltdown in her kitchen or something. I can't remember. And she was like, she threw all the cupcakes in the bin and she got like the mop and she was like, kind of like, smashing up all the cupcakes. And like,
yeah, yeah,
like, I remember one woman messaged us and she said, she was so angry and she did something and she kind of just stopped and everyone was just like looking at her and said, I don't know what happened. Like, I don't know what
yeah,
happened to me. And
yeah,
so I'm so glad you've talked about rage and I'm so glad we're talking about it more because even 10 years ago, this was not appearing as a symptom on any symptom sheet that you saw. Any healthcare
yeah,
professional that I would speak to or conference I would go to would not
yeah,
mention rage, but it's one that
mm,
people are terrified about talking about.
yeah, absolutely. And I think we need to talk more about it to reduce the stigma because I think it is so common and it's just the idea of, excuse me, women being like having big feelings. Like from a societal perspective, it's just not allowed, right?
Yeah.
Sorry, I'm just going to pause.
No, take your time, it's fine. My son walked past before and sneezed. You probably heard him.
I
Take
didn't
your
hear it at all, actually.
You're fine. Take your time.
It's so typical.
Take your
Yeah.
time. Do you know what I was going to think? My next question I was going to ask you was around like warning signs around P&D, but actually I think I'm going to flip that because we've talked about rage, which is something people are so scared about.
Yeah,
I wondered if we could talk just a little bit about the scary thoughts you can get because the
yeah,
two
yeah,
biggest things people talk about are rage. I don't want to say that I feel so angry that I could chuck things through a window, and
yeah,
sometimes do chuck them through the do chuck them through the
yeah,
window.
yeah, yeah,
And then second, the scary thoughts,
yeah,
intrusive thoughts.
yeah.
So
We can talk
what
about that,
are
Faye.
please do. What are intrusive thoughts? What are these
Mm.
scary thoughts? Should people be worried and should people speak up about them?
Okay. such an important question, and one I want to be really, really clear about, because the stigma and the silence around these thoughts actually causes so much harm. So, the research is really, really clear on this. Nearly half of all new parents experience unwanted, intrusive thoughts about harm coming to their baby. That's not half of women with postnatal depression, that's half of all new parents. So just let
Okay.
that sit, right? And in wider studies, that figure is up to 80%. Okay, so these are thoughts that automatically come into your mind, okay, uninvited, about something terrible happening. And sometimes, although it's often really hard to say this out loud, those uninvited thoughts are about something you might do to your baby. And they are distressing and they are unwanted and uninvited. And they are nothing to do with your values, okay? Now, what's really important to hold on to is that having those thoughts doesn't make you dangerous, okay? Women with perinatal anxiety and OCD don't act on those thoughts, okay? What they often do is that they suffer in silence because they're terrified that if they tell anyone, their baby is going to be taken away. Now, again, I want to be really clear with this. Babies are only taken away in very exceptional circumstances. So, disclosing an intrusive thought to your GP or your health visitor or your therapist is not one of those circumstances, okay? We expect these thoughts. We're trained to hear these thoughts without panicking, and naming them out loud for you is often, almost always, the beginning of them starting to lose their power. Okay, so yes, it is common, okay? And yes, it can be part of postnatal depression or anxiety or OCD, but they are not evidence that something is wrong with you as a mother. In fact, they're actually evidence that your brain's working really, really hard to protect something that it loves, right? And it's misfiring under that pressure.
And what kind of support can you get for intrusive thoughts? Because people are so frightened of them. So we get messages all the
Mm,
time with people saying, I've got thoughts of harm towards myself, towards my baby, and obviously they're incredibly distressed, sexually
yeah,
intrusive thoughts, all
yeah,
kinds of things. And people are so frightened to speak out. And we say, do speak out because then your plan can be tailored for you, exactly as you've
absolutely.
said. And so, it's this thing of if you open up to a healthcare professional about this
Mhm,
and you don't get the response that you have wished for, can you speak to
mhm.
another healthcare professional? Can you go to another one?
Absolutely. I mean, I suppose the go to the two healthcare professionals I would expect people to go to first are your GP and your health visitor. Now, you always have a right to be able to say, I want to see a different GP or I want to see a different health visitor. Obviously, that is within the constraints of, the practice or kind of what's available on the day, who's on duty, etc. But if you're disclosing something and saying that I am significantly distressed by this experience and make that very clear when you're talking to the receptionist of the GP practice or whatever, you should be able to access support from somebody that you feel is appropriate. And if you've had a bad experience, I'm going to use a GP as an example. If you had a bad experience with the GP in your practice and they say, yeah, you can see that GP at 3 o'clock this afternoon, it's totally within your right to say, actually, I don't want to see that GP. I want to be able to see a different one. And yes, you might have to wait a little bit longer, but but I suppose you need to feel comfortable to be able to disclose this stuff, right? This is really difficult stuff, very stigmatized stuff that people are holding and working with. And so knowing that it is such a common experience, even if people aren't talking about it, hopefully will give you strength to be able to take that first brave step, talk to somebody about it, and they will hopefully be able to put you on the pathway, whether that's connecting you with a perinatal mental health team or connecting you with your local talking therapy service, thinking about, reviewing, I don't know whether you might be on medications already, but thinking about your treatment plan, exactly like you said, and reviewing that. And also kind of thinking about what other kinds of support might you need in your life. It's not just about you, it's sometimes about the environment that you're in, the circumstances within which you're living your life. Like what other kinds of support are available to somebody in your situation?
I'm so pleased you said that. It's so incredibly helpful. And I think what's really good about these kind of sessions is that we have had women say to us, I went in with my phone with the session,
Mm,
at the point of whatever minute where people are talking about what's happened. And they've said, this is how I'm feeling. And I watched this
yeah.
webinar on Instagram. And also, we've had healthcare professionals say, I heard about these, but didn't do much training in them. Actually, these sessions have been really helpful. And I think
Mm,
you've just outlined there that you're not alone, especially with intrusive thoughts. You can feel like you're the only one that's had these really scary thoughts. Now, I've
absolutely.
experienced them. I've known thousands of women across the globe who've experienced them. You've worked with
Yeah,
people who've experienced them, and you can recover from them and perinatal mental
absolutely.
illness. And I think
Absolutely.
that's one of the things I want to move on to next in terms of recovery. What
Mm,
can recovery look like? So you've tipped onto it there. You go to see your healthcare professional. There's lots of different ways that you can recover, and everybody's journey
yeah.
is different. But what
Yeah.
can recovery look like, and what should people expect?
Um, so I think people can expect that it does get better. Okay. So with the right support, most people can make a full recovery from perinatal depression and anxiety, which is obviously what we've been talking about. That's what the evidence shows. That's what I see in my clinic room. But the other thing that I'm really keen to talk about is that early support makes it shorter and lighter. Okay. So if you catch postnatal, I'm using postnatal depression as an example, if you catch that at 3 months rather than 15 months, your road is going to be easier. Okay. That's not to put pressure on anyone, but it's more to give you permission to reach out sooner than you think you're allowed to. Okay. You do not have to be at crisis to access support. You should be able to access support across the entire journey. And if you do it earlier, it's going to be an easier road for you to manage. So, I guess in terms of how I work with people in terms of their recovery, so I'm a clinical psychologist, and I use a few different approaches depending upon what somebody needs. So, a lot of the work that I do is something called acceptance and commitment therapy, or ACT. And that helps people change their relationship to difficult thoughts and feelings rather than trying to get rid of them, and try and reconnect to what matters to them, to who they want to be, the kind of life they want to be living at this point. I also use compassion focused therapy, or CFT, which is also particularly powerful for that self critic that so many women carry on their shoulder. Yeah. And then for anyone where there's been like a difficult birth or trauma, EMDR can be really effective too. But underneath all the techniques, what I think often makes the biggest difference is something a bit more simple, if that kind of makes sense. It's having the context of actually understanding what's going on for that person. So not just the symptoms, but everything underneath them, like the system that's going on. So we're thinking about the identity shift, the relationship change, the gap between the mother that you wanted to be and the one that you have the resources to be right now. Okay, all within kind of the political context within which we're living in, the systems that we have access to, all the stuff that is impacting upon us. The problem isn't always just within you, it's a whole system of things, right? And so when we understand that, that's when things can start to shift. So it's not about feeling like yourself again, going back exactly to where you were before this all started. It's about finding out who you are now and who you want to be on the other side of this.
I think that's so powerful what you've said, because I think a lot of people go, have I failed because I feel like
Mm,
this? And they take it all upon themselves. And I think if we think where we are at the moment, like during last year's awareness week, Natalie, we did a whole day dedicated to financial insecurity and
absolutely,
maternal
yeah.
mental health. And I think so. I sit here now, my son's 16, I'm in a relatively comfortable position now to how I was when I grew up, and how I was when I had my son, and I
Mm,
sit here going, yeah, brunch bars are £1.35 instead of £1 now, I'm kind of, and I'm sitting there thinking, why is my 2 weekly shopping bill this amount of money when it used to be this amount of
absolutely.
money?
Yeah, yeah, yeah.
But then I look at the cost for new parents. Buggies are bonkers. Like
Insane.
who can afford £1,000 for, like, the majority of
I
people can't
know.
afford £1 for a buggy. And
Yeah.
then you think, I look at some of these hospital lists online of what people are supposed to have, and I'm like, you don't need that £800 machine that's going to boil some water for you or whatever it is. I don't know,
Yeah. Yeah, yeah,
I just,
yeah.
and I just think people, I work with mums, and I think we've got so many wonderful things now, like baby banks. You've got places like Sebi's Corner who can provide,
Yeah.
things to new families. And I just think you've made such a brilliant point, Natalie, there with about it's not all on you. And I
No.
think that's the thing. People carry this and they go like, have I failed? I feel so guilty. My friend over there had
Mm,
4 kids and she was all right. I always talk about that story that when people go, 100 years ago, Mary down the road had 18 children and lived in one room and she was completely fine. And I always go,
yeah.
well, I don't think Mary was fine actually.
Absolutely. Absolutely.
Which
Yeah.
probably wasn't. But we take it all on ourselves. We take it
Yeah.
all on ourselves.
Yeah.
And it, it it's you've made such a good point that there's so many other factors that come into it. And I think the financial one is the one that I keep
It's
thinking
huge. Yeah.
about. Yeah, because
Yeah.
people are like, how can I afford to have a baby? And people go, well, you shouldn't have a baby if you can't afford them. And you think, well, actually,
Mm,
having a baby now is so it's more expensive than it was 2 years ago. You
yeah.
know, like it's just it's too much for people to take. It's just too much.
It is, and I think it's also about the way that society is set up as well, like, not getting, enough support during maternity leave or
Yeah,
paternity leave to be able to support you in maternity leave, right? Do you know what I mean? Like it's just not set up to support people with young families.
no, it
It's
isn't.
about,
And I
yeah.
No, it's no wonder. I was saying to somebody yesterday, rates of P&D always differ depending on what you look at, but generally between like 1 and 8 to one and 10,
Yeah.
women experience it. And you think the reason it's so high is because of so many different factors. That I get
Mm,
really sad when people say, "Oh, I was reading blah blah magazine, and a certain A-list celebrity had postpartum depression. How can they get it?" And if you ever read comment sections in newspapers, which I encourage people not to read because they're just
yeah.
ridiculous,
Yeah.
they say, they're so rich, have they not got it? Because they have different factors which are
Yeah.
affecting them. And I think
Absolutely.
it's a massive discredit to women and society where we are just assuming people are going to be well because of certain life circumstances. And so I
Totally.
think you've made such a good point that it's not all on you.
Mm,
As a woman, there are so many different factors, which is why combinations of treatment, like you've so brilliantly discussed, are so good for you. It's not just one thing. And I think
yeah.
from that, because your work is so good, I say this morning, when I saw the thing about the wrong coloured whatever, I can remember the whole, you want a banana? Yeah, I want a banana. Do you want it peeled? Yeah, I want it peeled. Get the peeled banana. I wanted to peel the banana.
Yeah, I know. Oh, I didn't want it cut up. I want
The
a
world
whole
was completely
banana.
ended. Yeah,
Yeah.
the world was
Yeah.
completely ended. But so I just think the work that you do is so lovely, and I wanted to give some
Oh,
space
thank
to talk about
you.
Little Steps psychology practice. So
Yeah,
you've
sure.
given insight into who you are. What does Little Steps do? How can people come and see you? Where are you based? And all that kind of stuff.
Sure. Absolutely. So, Little Step Psychology Practice is a clinical psychology practice for parents across the whole arc. So, from preconception through to starting school. So, I work one to one online with parents across the UK. And the focus is really on those years that no one prepares you for. Okay. So, the antenatal period, the postnatal period, including NICU, and the toddler and preschool years. So the people I often see are highly functioning, conscientious parents, right? And they often don't feel like they're bad enough to warrant any kind of support. So my work, a lot of the time to begin with, is to show them that they 100% deserve support, okay? We don't have to wait till we're at crisis point. We just have to get the support in there early, okay? So you can find me on Instagram. I'm dr.natalie.psychologist, and the website is littlestepspsychologypractice.co.uk. I've also made a free guide for anyone in pregnancy who's looking for some practical psychological support, and that's called The First Gentle Steps. And it's on the website when you sign up to our mailing list. But I guess the like take home message that I'd like people to kind of go with, to anyone listening, whether they work with me or not, doesn't really matter to me. But the thing I want you to remember is you do not have to be in crisis to deserve support, okay? Little step psychology practice exists because too many parents wait until things fall apart. And it's my passion to help parents recognize that you deserve support at all stages of your journey, not just the worst one. So yeah, if you agree with that too, then absolutely give me a follow, get in touch. I'd love to hear from you.
Oh, lovely. And this will all go in the caption underneath. And then what we'll do
Good.
during the awareness week, Natalie, because obviously we're recording this a little bit before, is that on our stories we'll put links to the free guides and to your website as
Yeah,
well. But it'll be
definitely.
all within it. And you can obviously really watch this chat over and over. It'll be on our grid and on Facebook all the
Yeah,
way through. I just want to say a big thank you. I just think
Oh,
you're
thank you.
lovely. The work that you do, you're
Ah,
so reassuring in a space that can feel very, very overwhelming.
yeah.
Um, and a real calming voice. And I think it's great that you offer your services online so anybody can access them. So thank you so much for today. And thank you so
You're
much for being part of
welcome.
year 10 of the
You're
Awareness Week.
welcome. Congratulations on a decade.
I know, I feel
It's
really old
amazing.
now.
What an achievement. What an achievement.
Thank you. Yeah, the aim was always to give a free resource when we started to women like us who had been through it. And here we are 10 years later as like a global initiative. And I couldn't be more proud that the voices of real women like ourselves has shaped a movement. And for me, the whole point of the week is we here at the partnership don't offer services ourselves. The point of the week is being the vehicle to highlight the work of people like yourselves who
Mhm.
help families during their most difficult and vulnerable time. So it's a pleasure to have had you.
Ah, thank you.
Thank you.